Alright folks, so since there's only 8 people in here, including myself, I'm gonna have a lot of engagement. First off, I hope you guys are having a fantastic Monday. I had a double shot of espresso, so we're ready to roll. If you can, show me your camera. That's always good. Fred, good to see you. Carrie Ann, good to see you. I want to go over home health care because nobody really knows how to sell it, and I want to fix that today. So let's go over that, right? First things first, I'm going to just kind of go over the brochure with you guys real fast, and then I will also tell you how to pitch it. So a couple weeks ago and last week too, we touched on how, like, going back and calling your book of business. I would start with the same thing on this. I don't, like, my thing is, I'm not big on selling a whole boatload of products in one call, right? It's getting a little toasty in here. Let me turn the AC on. All right, so I'm not real big on, on one call, like, let's say, a couple of examples. Let's say you're on the first call, you sell them cancer, you sell them heart attack and stroke. Information overload is very real. So we don't want to just give them a whole boatload of things to digest. It's gonna hurt you, not help you. But lifetime value of a client is the most important thing for us. So why would we not, continue to touch base? So number one, you're talking to people consistently. That's so big because you're talking to people consistently and you're helping your retention, but you're also helping to build the lifetime value. So every time you talk to somebody, honestly, you should have something to pitch them. You should have some sort of product to go over with them. The biggest one, for me is cancer, heart attack, stroke, and hospital indemnity. That package deal is huge. But the truth is, this product here with Heartland National is who I want to go over. This product is extremely easy to sell. If you're not selling it, then you're not trained properly. The people that are above you are not helping you truly expand the lifetime value of your client. So if you're part of BDI in any way, that's what I'm giving you today. I'm giving you that little bit of juice that should be happening on a consistent basis. So, which a lot of you are. So, first off, thank you for being in the BBI organization, and I'll continue to help as much as I can. If you're not, then you should definitely consider joining because we're the best of the best. All right, now, what I want to do is, like I said, I'm going to go over this real quick. So, first off, you don't want to you don't want to do information overload. But the way that I do this is, I actually would do better if I write it down. So same thing for you guys probably. But if you have your first initial call, your first call where you make the sale. Let's say that you sell them. Also, you use my gold, silver, bronze package deal. You use that first video that we went over. And then last week we kind of went over how when you're talking to them the first go around, you make that sale, right? So you fast forward 6 to 8 weeks, right? So 6 to 8 weeks later, you come in and you give them a call to check in on them, ask them how they're doing, build rapport, and let them know that you have something available to them that they need. Okay? The home health care. If you don't know this, write it down. I'm going to give you guys some important facts to be able to sell this product. Home health care is covered up to 35 hours a week, which is a lot, right? They're going to probably get what they need. This product is really what you're not selling the home health care aspect of it. You're selling the fact that the home health aid portion is not covered. So what I always do is I always start off with, do you know the difference between home health care versus home health aid? Almost always they're going to say, no, I don't. Okay, so education is big part of my sales process. So the first thing that I do is I go over the fact that home health care is not is covered up to 35 hours a week. So you might need more than that, and then it's all your responsibility, but we'll get to that in a second. And then home health aid, you're transferring, you're eating, you're bathing, you're toileting, you're dressing, those types of things. And I'll be very blunt with them. I'll let them know, hey, you're married? Yes. Okay, obviously you don't want your wife to wipe your rear end if you can't fully take care of yourself. You don't want your wife having to carry you from the bedroom to the living room every day. You don't want to put that type of strain on her. You don't want to put that type of stress on her. So what we can do is we can get you a policy in place that covers, and I would get it for both of you, right? The bottom line is it's all about education. So what's the difference between home health care and home health aid? Explain it to them. All right. So like I said, I'm going to have some participation. Fred, do you know how to explain the difference between home health care and home health aid?
No, I do not.
All right. Simple. Home health care is medical in nature. Home health aid is not. So going to the grocery store to get groceries is not going to be covered by Medicare, obviously, right? So home health agencies are out there to help you with these day-to-day living activities that are not going to be covered by Medicare. Wiping your ass, taking a bath afterwards, going from the bathroom into the living room or the bedroom to lay down, getting a swing bed, whatever. None of that is covered by Medicare. Okay, so what we do is we set them up. That's that simple to explain to them, right? And then you set them up with, hey, the good news is I can get you this product, and a lot of times it'll make you money, and I'll go over that in a second. But first, I want you to know, I'm going to give you a gold, silver, bronze option just like I always do, and I want you to know that, of course, the gold option gives you more per day than the bronze option. My goal is to get you as much money, because it's not if, it's most of the time it's when. When you get into a situation, and I'm going to get to my next big point in a second, but when you get into a situation, Mr. Jones, where you can't take care of yourself, you don't want to rely solely on your family to do it. Financially, you can benefit to have a policy in place that pays you and your family directly to bring somebody in that's a professional to help you with this. All right, now, the next big one is, Mr. Jones, do you want to recover in the comfort of your own home, or would you like to recover in a cold nursing home, or not even nursing home, assisted living facility, or whatever, inpatient rehabilitation, right? Would you rather recover in the comfort of your own home or in some cold facility where you don't know anybody, your family has to come visit you there? You want to recover in the comfort of your home, I'm assuming, right? They always say yes. Okay? So do you want to recover in the comfort of your own home? I have to write this stuff down so I know where I'm at. So then you kind of let them talk, right? But then you just have a conversation with them about it. Right now, you're in a situation where, because Medicare is going to be responsible for what you get, you're in a situation where you don't get to say whether you recover in your own home or not. The good news is, when you get to the point, and then you go over the activities of daily living, when you get to the point where you can't perform 2 out of your 6 daily living activities, you will be able to activate an amount every single day that pays you, and you'll be able to bring someone in you'll be able to bring a professional in to help you and your family in that time of need, right? So you give them an example. So you want to have an example here. So, Mr. Jones, let me just tell you, if you...
Hey,
yep.
Johnny?
Go ahead.
I run into a lot of people who need hip surgery. Now, they need to, it's hard for them to get on and off the toilet, but it's only for a short time. You know what I'm saying? Would this policy help them for hip replacements? They need hip replacement, you're getting...
Absolutely.
Hip replacements.
Absolutely. So the way it would work is, okay, we'll go over the underwriting in a little bit. It's only 4 questions, the easiest underwriting out there. the way it would work is this policy, as long as your doctor fills out the claim, which I'll show you.
Because usually for hip, you can't, you know what I'm saying, it's hard to get around. You got to get on and off the toilet.
Mm-hmm.
Because I know a lady who just had someone come in and pay $5,000 and she'd have paid out of her own pocket. But I didn't know, like, if you can start and stop this policy.
So that's a perfect example. Yes. So the way it would work is, if she cannot perform 2 of her 6 daily living activities, okay, 2 of the 6, the doctor just has to file this claim. That's it. And then when that claim gets filed, she will start to receive her daily benefit for whatever she's getting. So how long do they usually have that treatment for?
It's in a few weeks.
All right. So it's going to pay, let's say it's a daily amount. So skilled nursing.
And she'll be at home.
Right. So let's say that she has the general nursing care, I'm assuming is one that she would get. Physical therapy is probably one that she would get. So let's just say that. Let's say she's getting physical therapy and she's getting general nursing care or skilled nursing care. Just one of the two, or maybe just one of them, right? If she has the complete package, she gets up to $600 a day. Let's just say she's getting one, just for math purposes. That's $300 a day. She's getting that. They usually get treatment every single day, I would assume, in that situation. Maybe the physical therapy comes, 3 days a week, and the skilled nursing comes, the other 4 days, right? However, it doesn't matter. What would happen is she would have somebody come in and she would pay them out of pocket, but with this policy, every single day that she gets that care, she would receive that daily benefit. So let's just say she's getting skilled nursing care 4 days a week, and you said it's 2 weeks?
Yeah, it was like 2 or 3 weeks. And, you know what I'm saying, because I guess she can't really get around, because she's single. All my other clients, their spouses help them.
Right. So let's do it's easy math. So
for the home health aid, that's what I was thinking, is that, and she wasn't too thrilled with the people they brought in either, because a couple of them are very lazy.
Yeah, and the good news is you can hire your own people, or you can pay a family member. Like, the money is yours to do with whatever you want. So skilled nursing care, 4 days a week, let's say, and then the other 3 she's getting physical therapy. It's the same math, except it's over 2 weeks. It's 6 for the physical therapy because it's 3 days a week. So that's $2,400 plus $1,800. So she would receive a check for $4,200, right? She would take that money and she would pay a home health agency, just like she did, like you're talking about. She paid like $5,000, right? She could choose whoever she uses too. I don't know if she just didn't like the people she chose, but there's all kinds of home health companies, right? So bottom line is, Kathleen, I hope that answers your question, but she would get a daily benefit of whatever she was receiving, right? So the doctor's going to file it, and he's going to put on there she's receiving physical therapy 3 days a week and skilled nursing care 4 days a week, and she's going to get that benefit amount, right? And I don't really know how the whole communication between Heartland National and the the people that are supplying it goes, but they send her the check. Check comes to her or him directly. Okay.
Yeah, but then how about on the home health aid? Won't she get help because she can't do 2 of the whatever?
The home health aid portion is an extra $150 for complete, $100 for standard, and $50 for basic. The bottom line is the actual home health care is usually not over 35 hours a week, which will be covered by her Medicare plan. Whatever her copays are, if she's on Medicare Advantage, or whatever kind of copay she has on her Medicare, she can use the money to pay. But her Medicare is going to cover the majority of her home health care. Because 35 hours is a lot, really. I mean, most of the time they're going to come in. The home health, the money as a whole, in my opinion, the majority of it's going to go towards home health aid. You don't have to use this money here. You don't have to use that money towards home health care. You can use it towards home health aid as well. Does that make sense?
Yeah.
So the money total, right? Because she's going to receive for home health care, she's going to receive the $4,200 over that 2-week period. But if you add in the home health aid, let's say that she gets home health aid added on it. It's for it's up to 120 days. You can add 60 days onto it as a rider in the application. So for those days that she's in that situation, she's gonna have, let's say, 2-week period, 14 times 150. She's gonna get another $2,100 for her home health aid. Does that make sense?
Yeah.
So she's gonna be, if she paid $5,000 out of pocket, you can use that person as an example, right? So that's a good selling point, Kathleen. Let's use your example here. You have a client that just paid $5,000 out of pocket for somebody to come in and help her, correct?
Right. And they don't sit there and make the bed. They're just doing her because she couldn't get around. You know what I'm saying? Get up and down. So that would be two out of 6. They get off the toilet. You know what I'm saying? It lifts you up.
Then she paid a home health agency. It wasn't home health care, right?
Yeah.
So use that as an example. Now, if I was a client, Kathleen, use your experience with that client to sell me a home health care policy.
Okay.
You get it?
Yeah. Oh, yeah. That's why I jumped on, because I was like, it seems like more people are getting hip replacements. It's not the old people who are bringing up the price of the med subs. Everyone's waiting for hip replacements to go on med subs. You know what I'm saying? Or Medicare Advantage. You know what I'm saying? Because it's much cheaper.
Yes.
Than with their work plan.
So how would you, to a new client or an existing client, how would you use that experience to sell it? I'm asking you. I'll help you if you don't know, but how would you, if you were talking to one of your clients, how would you sell the home health care and use that experience as that client that you had who paid $5,000 out of pocket? How would you sell it? Like as a role play scenario.
Well, when you're doing your fact finding, if you find out more about her regards to does she have any, especially if you know if they have any issues regards to their hips, it seems like a lot of people are going for hip replacements. That's why I thought this would be a good policy.
It is a good policy, but it's not just for hip replacements. What if somebody goes through?
Right.
What if somebody gets cancer and they're throwing up all the time and they can't do anything, right? They're weak. They can't get out of bed. Chemotherapy, for example, can be performed at home. It can be oral chemotherapy, right? They could get general nursing care to come in. They could get home health aid as well. Like there's a lot of different reasons. It's not just a hip replacement, right? So
right.
You could use it as an example. So what I would say is hey John, I just want to let you know, something that's very important for you to have is home health aid coverage. Home health care, John, is covered up to 35 hours a week. I'll give you an example. I had a client who had to come out of pocket $5,000 to pay somebody to come in and help them get off the toilet, get back to their bedroom, to the living room. Home health aid, unfortunately, is not covered by Medicare. Luckily, I have a policy that can help you with that. So if you have, chemotherapy, any sort of therapy at home, general nursing care, skilled nursing care, it'll pay you, and you'll be able to use that money to bring a private company in to help you. Let me ask you something, John. Do you know the difference between home health aid and home health care? No. Okay, great. And then explain it to him. Home health care is medical in nature. Home health aid is not. It's transferring, bathing, eating, toileting. It's the things that you're going to rely on your wife or your children for if you don't have something in place to bring in a private company. So let me ask you this also. Would you rather recover in the comfort of your own home or in some facility with people you don't know? And he's going to say, I want to recover in the comfort of my own home. Okay, I can understand that. I would want that as well. The good news is we have something that's available to you to help you with that coverage. So when that situation arises, you're going to make plenty of money to pay a home health agency. Grab a pen and paper and I'll give you those options real quick. And then you just say gold, silver, bronze, complete, standard, basic, and you say complete option is $88 a month. It gets you up to $600 a day for home health care and extra $150 for home health aid. So it'll pay you up to $750 a day, which is a lot of money. And then the standard package is this amount, and then the bronze package is this amount, and you're just explaining to them what it'll do. Then they take medications, the policies pay them up to $720 a year if it's standard and complete, and up to $360 a year if it's basic. So the bottom line is, a lot of times if they take more than 10 medications, the policy pays for itself. I have clients that make money off of this policy. Does that make sense, Kathleen? Do you see what I'm saying?
Yep, and a prescription drug is good because if you get on a prescription and let's say the doctor gives me a prescription and I don't know, Aetna, whoever tells me I have to go to step therapy and they give me a different drug and I'm like, no, then I can use that towards this prescription.
Yeah.
Because a lot of medications have step therapy and you don't really want to go through that. So this way then you can just use that towards this.
What I always do is I tell them the policy has a prescription cashback benefit. Now, by this time, you know how many medications they're taking, right? So you tell them, hey, look, you're taking 7 medications a month. You get your prescriptions monthly. They get them quarterly. It actually just doesn't benefit them as much. But let's say they're getting $15 for each generic drug. They take, 5 generic drugs a month. That's 15 times 5. That's $75 a month. Let's say they get them monthly. That's $900 a year. So they would get the full $720 at the end of the year as a reimbursement check. And the premium might not even be $720. The premium might be over, it might be under, but the bottom line is you can tell them, hey, at the end of the day, let's say the premium's $900 a year. You're going to get a $720 yearly reimbursement because of your medications, John. The policy's only costing you $180 a year. It's a no-brainer. So I would go ahead and go with the complete package.
And put the reimbursement at the end of the year?
Yeah, have them do it once a year. It's easy. All they need to do is download a list of their prescriptions, email it to Heartland, they'll send them a check with their policy number. Easy.
Hey, Johnny.
Yeah, what's up, Carrie?
I'm sorry to jump in. I just wanted to find out, so they can get their prescriptions reimbursed without activating this plan for all the other benefits?
Correct. There's a reimbursement form. I'll show you.
Oh, good question.
There's a prescription.
And then the other question I have really
Hold on one second.
quick
Let me answer that question. There's a prescription drug claim form right here. You download it. You have it. You send it to them. They don't have to put all the names. They don't have to put all this. They just need a list from their pharmacy. Their pharmacy can fill it out every single year. All the medications they got in the whole year, they print it out. They take this form, fill out the top part, email it to claims@heartlandhnlic.com. I think it is. But
So this would cover compound medications because they're insurance companies, I don't care if it's individual Medicare or not, they don't cover compound.
It doesn't matter what the medication is. If it's a generic, it's 15. If it's a name brand, it's 30.
Okay, as long as it's a prescription.
Mm-hmm.
Okay, the next question I have is in order for them to get paid for those other things that Medicare would cover, the doctor just has to fill that out on the claim that they're at home and they're doing skilled nursing, they're doing physical therapy, and then they can take that money then, because like you're saying, Medicare is going to pay for the majority of that.
Correct.
They can apply that towards having someone to come in and help them bathe, having someone to come in and help them with getting dressed for bed, waking up in the morning, all that stuff.
That is exactly right. That's exactly how you're supposed to sell it too. It's like, look, John, you do not have anything in place for a life-changing situation. Medicare's not going to cover you to wipe your rear end, John. You have to have something in place that comes in and pays you and your family to bring somebody in to help them with this. You don't want your wife having to be responsible for all this. You don't want your children having to be responsible for all this. The good news is, with your 5 medications that you get prescribed every single month, this policy is only going to cost you $100 a year. If you don't get it, you're crazy.
And then you're probably going to get to it, but what are the age on these? Because I don't know if this is sold in Idaho. I've never seen this one before, so I'll have to look it up.
I can tell you if it's in Idaho. The age is 8.
I did move all my contracts to BBI recently. I think they're all completed, but I wasn't told about contracting for this, so it may not be an Idaho plan.
It's in Idaho, I believe. I'll check for you right now, but it's 40 to 85 is the age group.
Oh, perfect.
As far as the...
Because GTL in Idaho, I think, is 55.
Let's see. Home health care. Let's find out. Maybe I'm wrong. Yeah, I'm wrong. It's IA? That's Iowa. Yeah.
IA is Iowa.
Yeah. Okay, so
Yeah.
it's not in that state. Sorry to break your
Our insurance commissioner is pretty picky on what he'll allow to come into the state of Idaho, which is good, but
Sometimes it's good. Florida doesn't even have a home health care policy, so that sucks. But Yeah, there's some states that people are just significantly more difficult. They just are. Every state's different, obviously. We know that as insurance folks. So, Carrie Ann, I appreciate you joining in. If you have anything else, let me know. Kathleen, same thing for you. I want to ask, does everybody understand how to sell it? Does everybody get it? There's not very many people in here, which is good. It's fine. I like it more intimate anyways. It's just crazy. First one I had 100 people on, and then nobody wants to come back. So the home health care policy, to me, it's not hard to sell. It's very simple, right? You have a need there. It's not covered by anything. The hard part is explaining it in a way that they understand it. And the most simple part, the most simple way to put it is explaining it in that order. Do you know the difference between home health care and home health aid? Okay, great. Explain to them that they need to have something in place so they can recover in the comfort of their own home. Otherwise, they're going to be forced into some nursing facility. And then give them an example is what I would do. Like Kathleen, you could use Kathleen's example, right? So you're explaining what the difference is. You're asking them, you want to recover in your home, right? In the comfort of your own home? Yes? Okay. So I'll give you an example. I had a client, she had a hip replacement. She couldn't get up from her bed, from the bathroom, off the toilet to go into her bed. So she had to pay somebody $5,000 to come in for those 3 weeks that she was doing that. With this policy, you would make money in that situation, which is what we want you to be in. We want you to be in that situation. And the good news is, because of your prescription medications, the policy is hardly going to cost you anything. So it's going to give you a reimbursement every single year. You're putting money into this policy. At the end of the year, you're going to get a $720 check. So you need the coverage. The policy is going to pay you to be on it. Which one of these do you want? The gold option is this, the silver option is this, and the bronze option is this. Gold gives you this amount per day, silver gives you this amount per day, bronze gives you this amount per day. Which one do you want to get? And that's it. So it's really not difficult. It's easy. The bottom.
And then you could start and stop those days. You know what I'm saying? So like down the road, if there's only so many days, and you know what I'm saying?
Say that again. I'm sorry.
You could use it for a short period of time. They only give you so many days, and then after. So I only use it for a few weeks. I only use so many days, and then when I need it again, it's available.
So
does it need a restoration benefit?
It does. So the way it works is you guys can.
Thank you, Carrie. I couldn't think of the word.
No, you're fine. You're fine.
So the way it works is after 180 days. Home health care. No, it's 360 days. Sorry. So the maximum is 360 days, but it has to be separated with 180 days. So after they've used it, all those days up, there has to be 180 days in between where they don't use it anymore. Like for those 180 days. Does that make sense? 180 days. Is that what the restoration period would be?
It's usually around 180 sounds about right, like 3 months.
Yeah, the restoration period is the amount of time in between that they're not paying anything out, right?
Right, they're not getting any services.
Okay, yeah, then it's 180 days. I know that for sure. It's on here somewhere. Here it is. To qualify for
Okay, so let's just say this is a stupid example. I go for hip surgery, I use these, wait 3 months later, 180 days, and I go for, I don't know, knee surgery. So.
Oh no, actually you have 360 days. It pays out 360 days. I wish Brandon Reed was on this call because he created this product. He was on here the other day. But 360 days, I'm assuming is like if you use 3 weeks, so you use 21 days. I think that just takes 21 days off of your 360-day benefit. So like if you go 2 months, if you go a month, 30 days without using it, and then you break your neck, and you need it for 300 days, you have 339 days built up, right? So I'm pretty sure that's how it works. And I can.
Yeah, it's up under frequently asked questions. It says the benefits restore back to 100%, leaving your client with an additional 360 days of services.
After 180 days of.
After 180.
But if within that 180 days you still have that whatever's left of the 360.
Yeah. That's
amazing. It's a freaking awesome product. At the end of the day, you just got to know how to position it. You got to know how to sell it. That's the thing. And our job as insurance agents is to let people know what's available to them. That's the biggest issue, is that people don't do that. People think, oh, I'm just going to help them with their Medicare plan. Guess what? Somebody else out there is selling them other things. They have other deposits coming out of their bank account that cover certain things that they believe in. Your job is just to show them what they need. They need that coverage. They don't have anything to cover them. Kathleen, use your client as an example. Everybody in here, use Kathleen's client as an example. You know, I had a client that not long ago had to come out of pocket $5,000 because she needed services that wasn't covered by Medicare. This policy covers those services. It's easy. And then the reality is, you just have them write it down. John, you have 10 medications a month. This policy is going to give you a $720 reimbursement for the year. The total policy only costs $900 right now for you. 900 minus 720, it's $180 a year.
God, I don't think I've had 10 medications my entire life.
I haven't either, but some of them do. We all know that.
I know.
For sure.
So
Yeah.
it's
I have a client who's on 18. I'm thinking, Jesus.
oh no, I've had, and the thing is, if they tell me, I always ask them how many medications are on. If they tell me over like 20, I'm like, dude, I'm gonna find you medications without you having to listen. We'll go find them some other way. Michael, do you have a question? If not, it's good to see you either way.
So Johnny, here's a story that everybody could share too. My mother was diagnosed with lung cancer at the age of 48, and she never got onto Medicare. She lived until the age of 58, but because she did not want to go on to hospice, she felt it was a death sentence. So my father and I were taking care of her and taking turns. I would go and help her in the shower and bathe her, and she was not even on Medicare at that point in time. So that anything that we would have gotten for her would have been 100% out of pocket until she got onto hospice, and then hospice came in and did all that stuff. But yeah, and she ended up passing away at 58, so she never even made it onto Medicare.
And
so that's a whole other story, right? Because it's younger people that can qualify for this plan. So that's ACA, that's Medicare. It's a whole avenue.
It's so cheap for them too. They literally, people that are under the age of like 50, they get this product for nothing. I mean, it's like nothing. It costs nothing. And
Hey, Donnie, I'm gonna go talk to the commissioner tomorrow in Idaho. Would I just reach out to Kelly to get a copy of this brochure and ask him why it's not available in Idaho?
I mean, I can just send you the brochure right now.
Okay, thank you so much. I appreciate that.
You're welcome.
I just don't understand. GTL is the only home health care plan we have here, and this has all the same benefits GTL does.
So the reason I can tell you, the
That's
reason.
wild that you got GTL, but you can't get Heartland.
I can tell you the
Oh,
reason. The reason is that carriers don't get into certain states is because their product portfolio is not robust enough. So GTL must either be connected in Idaho, or they have a more robust product line than Heartland does. Because Heartland, like I've talked to the owner of the company, I've talked to the CMO, like I'm good friends with them. So they like Michigan, for example, doesn't let them in because they're not there yet. They're not where Michigan requires. But I'm gonna send you the brochure and you see if you can't get them in there. I'm sure they're already on it.
Can you connect me with the owner of the company too? Because maybe they know the reason why they're not in. Because Idaho's big on limiting benefits. Like our short-term care plan, it can't go past 270 days.
I'll just text him right now, and by the end of the call, he'll probably respond.
And I'm sorry to take up anybody's time, Johnny. If this is something that you want to talk to me about on a side issue, I'm happy to do that. No problem at all.
Interesting.
Let's go over the underwriting real quick, okay? First of all, this is the application. Cool. Benefit type, complete, standard, basic. The less coverage, the lower the premium, obviously. Hospital confinement, if they can't pass health underwriting for the hip, this is a really good one. It gives you, if you're on the complete, it can cover their hospital copays, and because you really want to add that if they can't pass health underwriting, that's when you want to add that for the hip, right? But it's just a good secondary, right? If they don't have the qualification process for daily benefit on hospital confinement for the hip, you can add it in here, and I'll show you the underwriting in a second. Severe accident and death benefit, 5 or 10,000. Additional home health aid coverage, always add that because it's literally nothing. And then ambulance, give them a $500 benefit for ambulance. That'll cover their co-pays for ambulance rides. So here's the health underwriting. Are you currently receiving assistance or supervision to perform activities of daily living? Basically, would you immediately use this policy? Are you currently receiving home health care services or confined to a facility? Within the past 12 months, have you been diagnosed for Alzheimer's, dementia, or memory loss? And then lastly, if you're applying for the complete package in the next 60 days, do you expect to be admitted to the hospital, nursing home, assisted living? Like it's basically, would you use the policy right now? This is the only real health question here. And that's because this automatically qualifies them. Alzheimer's, dementia, memory loss, like that automatically qualifies them for the coverage. So that's all it is. Very, very simple underwriting.
So for the hospital, they have to be admitted in, because in Idaho, they're doing hip surgeries as an outpatient surgery.
Yeah, they're doing outpatient.
Wait, what's the question?
So for the hospital, if you go back,
You're talking about
when we
this?
talked about the hospital benefit, no, the other page, like the daily hospital benefit.
Hold
If
on.
you hit previous, I think it'll take you back to those
Right here.
questions. Oops. So in the
Oh, I know what
thing
you're
you were
talking
doing
about.
a
I know
daily
what you're talking
hospital benefit where they could get $300 a day, is that
You're talking about
only
this.
for if they are admitted into the hospital, or does that work for outpatient?
No,
and-
it doesn't. It's confinement. They have to stay overnight. So if they're in there, they have to be in there one night. If they're in there one night, then they get $300. If they're in there 2, they get 6, all the way up to 3,000.
What if the hospital does not code them as inpatient and they keep them coded as outpatient? Because that's a big problem too sometimes.
I don't think there's anything.
Yeah,
I don't think there's anything you can do about that.
surgeries are now becoming, in and out.
Well, sometimes you keep people for observation too. Like if
Observation.
you did the hip surgery, let's keep you for observation overnight, but they're not actually admitted in.
Admitted, right.
That's something that I don't know the answer to that. I really don't.
Okay.
That's something that
Yeah, I was
you.
gonna say, normally doctors, they come in, they'll let you know if you're gonna be up under observation or you're gonna be admitted. So I think they kinda let the family know exactly what's going on with that.
Well,
That was my
I
experience
think
in the past with my clients.
it's
I
about
just
what it's
understand
coded
what
as.
confinement is. Is it a 24-hour stay or is it admitted in? It's just,
I
just to
think
be-
confinement
so I know.
confinement answers it. If you're confined in the hospital overnight, it's a $300 benefit.
Yeah.
That's what I think. I don't think it matters whether it's admitted or observation. If they're under overnight, it's gonna pay out.
Hey, Johnny.
The biggest issue is that you have to get a UBO4 form from them and send it in. Who said Johnny?
Michael Mother.
What's up, buddy?
Hey, man. You have to be confined in the hospital for 24 hours.
That's what I figured. So if it's
That's what,
so-
that's
so
what
if
it says in their training.
so if it's overnight and it's only 16 hours, they don't qualify for it. Makes sense.
Well, Michael, doesn't matter if it's considered inpatient or outpatient? I mean, in observation or inpatient?
It does not. You have to be confined in the hospital for 24 hours according to their
Okay.
training. So, hey, Johnny, one other point, if you don't mind me backing up to the prescription drug benefits, just doing the math on this, you've got a client that has 4 prescriptions a month. That's $720 in reimbursements. So anyone that has 4 medications on a monthly basis, they are going to max out on just generics, the full $720 prescription reimbursement. And I've sold 4 in the last 2 weeks, and I've got another appointment this week with a client that I reached out to. So as soon as I learned about this policy, it just, your client list and knowing how many prescriptions they're taking, those are the people that you can reach out to immediately on this. And if you've got somebody that's 65 years old looking at the standard plan, here in Oklahoma, it's $43 a month.
It's crazy, man.
It's $48 for the complete plan. So people are going to completely pay all of this year premium if they only have 4 medications a month.
And it doesn't, Michael, it doesn't matter if it's, you know, cheap crap compared to expensive.
No, even if they have a $0 copay on this plan, they're going to be reimbursed $15 for a generic. And I think, is it 15 and then 25?
30.
Or is it 30? Is it 30? Thank you. 30 for a brand name. So if you have 4 generics, 4 times 12 is 48. 48 times 15 is 720. So 4 generic medications are going to
Wow.
be $720 a year back. And if they're all tier 1 medications and their prescription coverage is a $0 copay,
They're making
that
money.
means they're getting $720. This plan is too good to be true. And
Yeah.
I'm not even talking about the home health care portion of it.
Yeah, if they're already a client, you know, like in your files, you have how many prescriptions they take. You basically just call them and saying, hey, I got something I need to help you get signed up for that'll actually end up making you money. You got to take a second to talk about it now, and then you just tell them, hey, home health aid's not covered by Medicare. There's a new state-approved policy that gives you up to $750 a day. It costs you $48 a month. However, you're going to get a $720 reimbursement at the end of the year, so you end up making $120 or whatever. It's very, very simple. It's got a, you know, I'm gonna send you the information on it, and just assume the sale. I mean, at the end of the day, it's like you're investing $48 a month in it, and like if they're older, you know, this is a 68-year-old. This is Alabama, I think, but this has this added to it. Take the $28.29 off, and now if they have a plan, if they have a Medicare Advantage plan, add that to it. Tell them it'll cover all your hospital copays, and if you get, you know, in your recovery, you can't perform 2 of your 6 daily living activities, it'll pay for all your home health aid, which isn't going to be covered. And then tell them a story, and then say, boom, it costs $76.91. When you do the math on that, let's just say 80 times 12, $960 a year. They pay $240 a year. It's easy. But yeah, that's.
Hey Johnny, how much is that severe accident and accidental death rider? Isn't it like $3?
It's very cheap.
That is unbelievable to tell somebody that they can get a $10,000 accidental death benefit rider built into that plan. It's an unbelievable value add.
Yeah, I always do gold, silver, bronze, and I would do it like this. I would do gold like this, and then I would take everything off. I'd do silver probably like that. Actually, no, I'd probably keep like something on here.
I feel like I'm on a diet and I'm at a dinner table watching everybody have macaroni and cheese. This is killing me. Like, I don't understand why this is in Idaho. Oh my gosh, this could replace 3 plans that I'm trying to sell people right now, and I could just do 1 with 3.
Here, Ann, use the GTL policy.
Yeah, just use GTO.
Yeah, but it still doesn't have all of these benefits here for Idaho. Idaho is just different. Like, I've seen people in Arizona where their GTL has much different benefits than what we have, and it's better. And I don't understand why. So,
what is
Do you have
your
Manhattan Life in Idaho?
we do. We have Manhattan Life in Idaho.
Manhattan Life has a policy that's very similar to this.
Right.
It's not quite as good, but if you're stuck with not being able to use Heartland, find another carrier that's going to be pretty comparable. And I know that Manhattan's plan is going to be a little substandard to this one, but it's an option for you.
What's your email, Carrie Ann?
It's Carrie Ann, so my first name,
I see it.
at PTIB, so Personal Touch Insurance Benefits, Idaho, all spelled out.com. So Carrie Ann, PTIB, Idaho.com.
All right, I'm sending it to you.
Okay.
I've got another appointment, guys. I've got to hit the road, but I hope this helped you all. And
It did.
you know, if you did get something out of it, take a picture, post it on Instagram, tag me in the story, and I appreciate you guys a lot. So God bless you all. Thank you for showing up, and I'll talk to you soon.
Thanks for doing this, Johnny.
See you guys.
Peace.
Bye.